health experts fear more infections could mean more mutations of that virus, similar to what we've seen in the Delta variant. And some areas are now recommending a return for mask mandates and other COVID restrictions. So here to sort this all out is Dr. Cara Christ, Director of the Department of Health Services here in Arizona. Dr. Christ, thank you very much for joining us.
Thank you for having me.
I want to talk and start off with the Delta variant. Is that the dominant strain here in Arizona? And when you talk about those who are being infected right now, what are the demographics?
So we are seeing increased prevalence of the Delta variant here in Arizona. It's not our predominant variant just yet, but it's been increasing significantly over the last couple of months. We know that it is transmitted more easily, so that's why we're recommending that everyone get vaccinated. What we're seeing is that the majority of our cases and the majority of our hospitalizations and deaths are in unvaccinated individuals, and we're getting a lot of cases in our 20 to 44-year-olds.
And so that's obviously a younger demographic than we were seeing when the pandemic was first hitting about a year ago. As far as the push to get more people vaccinated, what is being done out there?
So we're currently at about 50% of all Arizonans have received at least one dose, and we're going to keep going. So we are working with community leaders, community organizations to make the vaccine more readily available in neighborhoods and communities where people can go get it very easily. They can talk one-on-one with the individuals so they can get their personal medical or health-related questions answered. And we are just trying to make it as easy as possible all around the state so that all Arizonans can get vaccinated.
I don't know if you heard me talking about a possible booster shot. We heard Pfizer come out and say that they're going to seek authorization through the FDA for a possible booster next month. Are they being presumptive right now to even discuss boosters, especially when Washington University reported years of possible protection from both the Pfizer and Moderna shot in their latest research?
So I think that the research is showing that, the vaccines are highly effective against COVID, and being fully vaccinated gives you a really good efficacy. It's about 90% protective if you're fully vaccinated. As we continue to learn more, we've always had the possibility of boosters out, talking about 6 months, maybe a year later. So we continue to watch the data. I think the Delta variant and the potential of other variants may move that schedule up. But right now, the data is showing that the vaccines are effective and we don't need boosters right at this time.
Doctor, with the Delta variant concerns out there and school starting in a few weeks, what's being done to protect our children and students, especially after the governor now banned public schools and universities from enforcing mask mandates?
So we're working very closely with our partners at the Department of Education, our local health departments, as well as our schools and school districts to give them recommendations to make sure that they have access to pooled testing if parents would like their children to participate in that they have access to masks if students would like to wear them. We recommend that if you are unvaccinated and under the age of 12 is not eligible for vaccination at this time, that you wear a mask whenever you are with people that you don't live with, because we do know COVID, and especially the Delta variant, is here in Arizona.
And just into our newsroom, U.S. public health officials say vaccinated teachers and students don't need to wear masks inside school buildings. Are you okay with that?
Yes, so we do support the CDC recommendations. Our recommendations are that if you are fully vaccinated, you can, attend gatherings. You don't need to wear a mask indoors. We would caution those that are at high risk for bad outcomes, such as hospitalization or death, that if you are going to be with people you don't live with, even if you are fully vaccinated, to wear a mask at this time.
Doctor, we always thank you for taking some time. We know you're extremely busy, so we wish you the best and we look forward to speaking with you soon.